I want to get you some breaking news right now. Governor Newsom has begun giving his remarks on the coronavirus response here in California. He's anticipated to possibly announce stricter restrictions. So let's listen in.
This pandemic, the effects of Thanksgiving, they have not yet been felt. They will be felt in a number of weeks. Dr. Fauci, I think, said it best. He says we should anticipate a surge on top of a surge. Take a look at what's already been happening. Again, these are pre-Thanksgiving numbers. The 14-day positivity rate has grown from 5.2% now to 7%. The 7-day positivity rate even higher. You can see hospitalizations now have increased 86% just in the last 14 days, and ICU admissions 67% over a similar period of time. We've seen death rate increase significantly over the course of the last number of weeks. Just take a look at this slide. A month ago, on November 2nd, we reported tragic loss of 14 lives related to this pandemic. In the last 24 hours, similar to the previous 24 hours, we've reported back-to-back days with 113 deaths. Just in the last 14 days, close to 1,000 Californians have lost their lives due to COVID-19. The bottom line is, if we don't act now, our hospital system will be overwhelmed. If we don't act now, we'll continue to see a death rate climb, more lives lost. And that's why today we are, pursuant to the blueprint we put out some 14 or so weeks ago, pulling that emergency brake. We've done it sequentially over the course of the last number of weeks, but we're doing it in a much more broad and much more comprehensive way today. We're announcing and introducing a regional stay-at-home order in the state of California, fundamentally predicated on the need to stop gathering with people outside of your household, to do what you can to keep most of your activities outside, and of course, always most important non-pharmaceutical intervention, that is wear face coverings, wear a mask. Here's what we are introducing today. Regions where the ICU capacity is falling below 15%, we are now mandating that we are implementing a stay-at-home order for 3 weeks. These regions are defined by this slide. We have 5 regions in this state. These regions are considered and constructed based upon a pre-existing mutual aid system in the state of California. You may recall a number of months back in Imperial County, we had a situation where their ICUs and hospitals were overwhelmed. We had pre-planned strategies for mutual aid and surge capacity. Again, it's all part of a regional strategy well defined within the hospital and healthcare delivery system. We've defined these 5 regions: Northern California, Greater Sacramento Bay Area, San Joaquin Valley, and the larger region in Southern California. Take a look at what our projections suggest. The 5 regions that we have highlighted, most of these, 4 out of the 5, we anticipate as early as the next day or 2, as early or rather as late as the next week or so, that the Greater Sacramento, Northern California regions, as well as San Joaquin Valley and Southern California regions will have reached that 15% or less ICU capacity. The Bay Area may have a few extra days. Our current projections suggest mid, maybe late December, but all within just the next few weeks, our ICU capacity in the state of California will drop in these 5 regions, not just in the aggregate, reminding you none of us live in the aggregate, but in these regions where we all reside, 40 million of us. The ICU capacity in all of these regions by the end of this month will drop, based on our current projections, below 15% in total capacity. What does a stay-at-home order mean? What is on that list in terms of augmentation and new protocols and new guidelines? Take a look here that we're looking temporary closure when the region is placed in the stay-at-home category that bars, wineries, personal services, hair salons, and the like will be temporarily closed for that 3-week period. Those sectors that will remain open in this new criteria include schools, bars closed, schools opened that have received waivers with the appropriate oversight and safety protocols that we have advanced and we demand in terms of standards. Critical infrastructure, broadly defined on the previous guidances, we have put out retail occupancy at 20% capacity. What we want to avoid is concentrating just in large box retail, too much of concentrated retail activity that actually would induce more mixing, not less. Thus, the decision by our health professionals and our advisors, which are ample. We've been reaching out across the spectrum for a number of days now to get insight and valuable consideration that we put into play, made that determination on retail. And restaurants be open, continue to be open for takeout and delivery. And I just want to acknowledge Jacques Conde. I want to acknowledge the California Restaurant Association. As a restaurateur myself, as someone who quite literally started right out of college, opened a small retail business and a restaurant, I deeply empathize and I have deep appreciation for the stress and the struggles our restaurants have had. And I want to just acknowledge incredible leadership of Jot, his board, acknowledge incredible leadership of Jot, his board of directors and his team. I know how difficult and challenging this is. And I just want to thank them for their insight and for their recognition of this current moment that the state of California is in. We're also establishing a framework where all non-essential travel is as well temporarily restricted statewide.